Heart disease is unfortunately extremely common. It's the #1 killer of men and women in this country. Just around about 1 million people a year die from heart disease. So it's actually more than the number of deaths from all cancers combined.
I just didn't really feel very well, but didn't know what it was. And of course, we always like to deny. After I got to see Dr. Roth, had said that I needed a new valve. And the nurse had said to me the only way they could fix it was open heart surgery again. And she said to me, if you think that the first one was bad, the second one will be worse. And that's when I made the decision that I am not going through open heart surgery again. It takes a long time. The road back is long and hard. But then they came out with this new surgery where you can go through the groin. Some of them have it done, I guess, through the arm and have the new valve put in. But I was still shaky, you know. Maybe I was thinking that I was being a guinea pig or something. But Dr. Roth had told me, he said, it will go until you will pass out. And if you pass out, you better get to the hospital as quickly as possible. That is exactly what happened.
I first met Effie in April of 2016. She was referred to me by her primary cardiologist, Dr. Rob Roth, who had been following her for many years. Effie has a lot of heart problems in addition to her aortic valve disease. She actually had open heart surgery once already for bypass of her aortic, of her coronary arteries. So her chest had already been opened up once. Effie was really an ideal candidate for the TAVR procedure. She was high risk for surgery. She had severe aortic stenosis and was very symptomatic. She could barely walk without getting short of breath. She was retaining fluid in her legs and her abdomen. She was miserable. She wasn't eating. She was passing out. She really couldn't function much longer going that way with her aortic stenosis. So we felt that she was pretty critical. We didn't feel comfortable sending her home because we thought she'd end up right back in the hospital. And we actually ended up transferring her directly from St. Mary's to Madison, where she had her TAVR procedure. We put a tube into the femoral artery, the artery in the groin. We put a catheter up and around through the aortic valve. And on that catheter, there is a new valve. That valve is crimped on a balloon. Very small, like a piece of origami, and it's inserted through the artery up and around the aorta, and it's positioned inside the old valve. So the old valve is never taken out. This is not a surgical procedure. We put the new valve inside the old valve. We expand it with a balloon, and the old valve is squished to the side, basically.
What's your choice? It's you have the surgery, and if you don't make it, or you go home and die in your own fluid. So, was I afraid? No. I had my surgery on the 6th of June. The 8th of June, I came home. And everything has just gone well for me. I'm just doing things for myself. I do all the picking up of the sticks and pine cones. I do my own cooking, I do my own cleaning, I do my own shopping. I'm just doing really well. I'm glad I've had the surgery. The TAVR procedure changed my life. It got me back to what I was doing before.
What I love about cardiology is that we can help people with a range of interventions, from something as simple as community education about the importance of blood pressure to something as high tech and amazing as TAVR. Even though we have those technologies, we know that sometimes the most profound impact we can have is by community education, community outreach.
The overall goal of the Be of Good Heart program is to go into the community and find people that have not been diagnosed with a chronic illness like diabetes, high blood pressure.
What I see in the community is many clients don't know that they have a chronic disease, and then there are those who know they have one but don't have the medical management of it, and then there are the others who don't understand it and they're not taking their medications as they should. So with all of that, you get complications from the chronic diseases.
By being able to go into the community, our goal is to hopefully find people, be able to educate them, help navigate the healthcare system, get them to a primary provider so that they can get the treatment that they need, so that they can get their their chronic illnesses under control, which would lead to, a happier, healthier life for them.
The Be a Good Heart program is very close to my heart. It is really why I do what I do. I started out as being an intensive care nurse, a medical intensive care nurse. So I saw people come in critically ill from not managing their chronic disease well. It inspired me to go out into the community and make a difference. We're so pumped up and so excited that we're going to be screening again and have a specific program that we can put people into. It is going to really enlighten the community.